हेच आहे का पण अरे हे आलं पाहिजे ना आपलं कॅमेरा सर बघ ना कॅमेरा असं वर जात इथे इथलं इथलं थांब हेच आहे हे इथले तेच हां असं करायचं कॅमेरा काय होतं नीट बसला का नाही बसला लाईव्ह चालू नंतर ऐकू झाल्याशिवाय व्हिडिओ हां मॅडम अरे बोलणार येते ना पण कोण म्हणलं तिथून स्पीच करणार आहेत ना मोबाईल सर्व करून आडवं झालं हे लूज कर हे लूज कर हे लूज कर हां आता ते गोल फिरू हां इकडे करता ह्या साईडला करता असं असं इकडेच बोलणार मॅडम इथंच होणार आहे ना सेशन इथंच इथूनच करणार आहेत ना सर का तिथं स्टेजला तिथं समोर का तिथं सर सेशन कुठून करणार आहेत इथं समोर ओके सर नारळ सर इथं थांबा जरा समोर या जरा समोर उंच करावं लागेल ब्लॅक होतं उंच करावं लागेल हाईट वाढव हां असं बी करावं लागेल झुकावं लागेल उंच करून हाईट परत सरळ करावं लागेल हाईट वाढवली ना मग व्यवस्थित होईल ब्लॅक दिसते खालना अँगल पडतो म्हणून सरळ करू का कसं करू सरळ ठेव हां असं सरळ ठेव हां फिट कर आता सगळं उंच करू वर कर चालू झालं जा 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 पोस्टर दिसत नाही थोडं खाली काम सुट जाऊ बरं स्टेजवर जा त्या स्टेजवर हे समोर नाही अंधार दिसते सगळा इथं दिसते ना एवढं काय ब्राईटनेस काळं दिसतंय रे सगळं काळं दिसते काळं लाईव्हला नसतं ब्राईटनेस आकस्मिक झाला का ब्राईटनेस हां अडू नको ना
and Indian Hospital Pharmacists Association. He has published 50 articles in national and international journals. He guided 8 PhD scholars and 48 young farm students. He has been in the body of administrative as vice principal, head of the Department of Pharmaceutics, in charge industry institution interaction cell, academic in charge, MBA coordinator, and cultural in charge. He has awarded. He has 15 awards in conference, seminars, and workshops organized. He has 2 books published and 1 e-book published. He has worked as a researcher project evaluator for CSIR New Delhi, chaired the scientific session for AICTE sponsored one-day seminar on global regulatory requirements for drug and pharmaceutical organized by Government College of Pharmacy, Aurangabad, and worked as expert for Avinash 2017 and Indian Jalwa. I would like to request Swaroop sir for present on co-crystallization, a recent approach to modify the properties of API.
Thank you. Good afternoon. After a long inauguration session and appreciation award, the resume or the biodata which is great, thank you, but I am not such a great person. I am just young individual like you. हंसो मत, young individual like you. मैं खुद को young ही समझता हूँ. क्यों young समझता हूँ? Because what happened? What is the life which is spent into the college that is not counted? These are all golden days. Count कब से शुरू होता है? जब तकलीफ शुरू होती है. So what I think, you are in that particular golden age, so enjoy your day, enjoy your every moment. And second thing is that start a lecture. So as soon as you heard the word lecture, what happened? कपाळ आठा पडतात आपल्याला. की आता आणखी एक तास ऐकायचे आपल्याला. So consider me not as an orator, not as a teacher, not as a speaker. Consider me as your friend. Well, what happened? मराठी सगळ्यांना माहिती आहे? मराठी जर तुम्ही बघितलं सगळ्यात जास्त आपण कोणाचं ऐकतो? आपल्या मित्राचं ऐकतो. म्हणजे ते वाईट असो चांगलं असो आपल्या मित्राचं ऐकतो आणि लक्षात ठेवतो, त्याला फॉलो करतो. तर मला एक मित्र समजून बघा, दोस्त समजून बघा, आणि माझं टॉक जे आहे, आपलं जे डिस्कशन आहे, then you will start your discussion. So consider me as a friend. So how many of you are the M.Pharm students? Good. So many of the M.Pharm and D.Pharm students are there. So you are doing your research work, or many of you are there who are just on the verge of starting of any particular research project. How many of you think that you are not having the facilities at your college to do the good research work? Just raise the hand. How many of you think that you are not having the facilities at your college, any college? You are not having for the good research work. Many students are there, maybe they are afraid of raising the hands. Second thing is that, another question is that, to do a good research, a very high facilities are required. This is another myth. So that's why this is the topic what I selected, drug co-crystals, a novel game-changing approach to alter the properties of API molecule. A very simple thing is that, instead of directly going to a topic, I will ask you one question. One person is there, एक कोई person है, उसको अपनी personality change करना है. There are two approaches are there. Which are the two approaches? One thing is that you can change the clothing. You can change his clothing and you can change the appearance. And second thing, you can send that particular person to a gym and you can change the personality. So changing the clothing is developing different formulations. One particular API molecule is that if you are changing different formulations, that means you are changing the clothing of that particular API molecule and changing the personality of that particular API molecule. This is one approach where the formulation scientist is working, developing different formulations. Second approach is that you are sending a gene, means doing the slight changes into the API molecule so that there are some changes into the API molecule and it will be more perfect, more appreciable, more acceptable. Are you with me? So there are two approaches are there. One is development of formulation and second is changing the properties of API molecule. So next slide please. There are two questions are there. So if you see, what is more easier, to develop a totally a new thing right from the scratch or to change into an existing thing? What do you think? What is more easier? Obviously, the changes into the existing thing is more easier thing. Okay? So that's why this is an approach where you can change the properties of API molecule. You can make a API tailor-made as per the requirement, and you can have the required properties of API molecule just by changing certain things. Maybe a physical things are there that we are going to discuss. So here, a small change eventually can make a huge difference. So what saying? एक थोड़ा सा चेंज कि आप API molecule में कर देते हो, that may make a huge difference are there into the physico-chemical properties, into the ADME of that particular drug, into the efficacy of that particular drug. It's possible just by changing the small things in that particular API molecule. So that's why always that change should be for improvement, because nothing is perfect and nobody is perfect. So that's why no API molecule is perfect. Drug discovery scientists यहाँ बैठे हैं बहुत सारे, Dr. संतोष मोकले, Dr. Ashish from Gujarat. All our discovery scientists are there, but they will also agree that every API molecule is having certain problems. Nobody is perfect, no molecule is perfect. We have to make it perfect. Okay? We have to make it more acceptable by doing smaller changes. Things like this. So presently, all the B.Pharm students, if you consider, these are the strategies which are available for the treatment of any disease or disorder. Monotherapy with a single drug. Another is a more than one drug in a different unit. Two or more drugs which are given in a different units. Third is fixed dose combinations. FDCs are there, and all you are aware that many FDCs they are banned by the FDA. And last one is drug co-crystal, which is considered to be a more novel approach, which is just coming up. No doubt, there are certain regulatory ambiguities are there as far as different countries are concerned, but this concept is taking a shape, and if this concept is accepted, मैंने मेरे टाइटल में बोला है, it is a game-changing approach. If this concept is accepted by the FDA, it will be a game-changing for the API industries. Next slide, please. So as far as active pharmaceutical ingredients they are concerned, if you see, when we are talking about the active pharmaceutical ingredient, what is required is when the drug discovery scientist is working on this development of any particular API molecule, he or she try to develop a perfect molecule. So what is a perfect molecule? That perfect molecule is having a good potency. Second is having good selectivity, because only potency is not important, but selectivity is also important. Because if drug is not selective, what will happen? It will have the effect on other parts of the body and having more toxic and side effects. Third thing is required good ADME properties, good pharmacokinetic properties they are required, because unless and until drug is not having good pharmacological properties, drug will not show the good effect. And good material properties, these are also equally important. What happens while developing any particular API molecule? The formulation scientist, the drug discovery scientist, yes, Mokresan, you will also agree with this. What happened? You are only concentrating onto the ADME, only concentrating on potency or selectivity, but the drug discovery scientist is rarely concentrate onto the material properties, compressibility of that particular drug, the flow properties of that particular drug, solubility of that particular drug. These are the problems which are giving trouble to the formulation scientist. Agree? सच को लगता है? That's why solubility problem है, इसलिए भी इतने सारे cases बन रहे हैं. Because if you see in M pharmacy, मैं कई बार बोलता हूँ कि 50% cases they are on the solubility enhancement. और मैं लास्ट 15 साल से देख रहा हूँ वही फिगर है, वही लिखते हैं more than 40% of drugs they are suffering the problem on this. आप कोई गाइडेंस फाइल कर ही रहे हैं, है ना, कि ये कई सालों से लिखते आ रहे हैं. But this is true also, because maximum drugs they are suffering the problem of solubility. That's why these material properties, especially compressibility, solubility, flow properties, they are not taken into consideration as far as developmental science is concerned. So how the drug is there? Selectivity. So proper drug molecule is that which has all optimum properties. going to select that particular drug which is having all optimum properties are there. If you consider the APIs which are available into the market, they are having different, you can say, classification depending on their solid forms. Basically, there are two types of forms are there. Even B.Pharm students can understand this. That is, one is crystalline form and other is amorphous form. Which is more soluble? Anybody? Anybody? Amorphous form is more soluble. And industry is now driving towards conversion of crystalline form to amorphous form. Because we know that amorphous form is having the more energy, no crystal lattice structure, and that's why it is more soluble. But what is the problem of amorphous form? That is unstable. So stability issues are there with the amorphous form. Many ways are there using different polymers. You can stabilize that, but there are certain limitations. So that's why the crystalline forms are there. In crystalline, there are two types of forms are there. Single component crystals and the multi-component crystals are there. Single component, one API molecule is there. Within multi-component system, it may be a solvent, it may be a hydrate, it may be a salt, or it may be what we call as a co-crystal. अभी ये रिसेंटली इंट्रोड्यूस हुआ है, जैसे कोई नई मूवी रिलीज होती है ना, अभी ये 5-7 साल में रिलीज हुआ है, नया मॉलिक्यूल, नया चीज आ गई है, को-क्रिस्टल से ये कंसेप्ट धीरे-धीरे आ गया है. After 2012, this concept is introduced as a co-crystals. Next slide, please. This is a schematic representation for understanding purpose. What is the difference between the different solid forms? One is pure API molecule, single is there. Second is polymorph, a different crystalline arrangements are there, that is polymorphs are there. This is also one of the area to work with. मैंने पहले ही बोला कि every M.Pharm students and PhD student want a novel topic. पहली चीज require. Second चीज, सर मेरा publication होना चाहिए या patent होना चाहिए. गाइड भी बोलता है publication होना चाहिए. काय नवीन केलं? हम बोलते हैं सर drug नवीन है. Polymer तो होता है, drug नवीन है. किंवा drug तोच आहे, polymer नवीन आहे. And second reason is that one, हा drug का select केला? तो very good answer what I get, sir हाच available होता. है ना? Yes or no? So what I am saying you, for this particular topic, you are not going to require a very huge type of equipments are not required. In a simple laboratory or any college can do this particular project. And with a novelty is there. So that's why polymorphism. Second is this clatrats, this D is the clatrats or the hydrates and solvents are there, where the solvent is entrapped. When the solvent is water is called as hydrate. Then comes is last is a drug co-crystals, where this blue part is a co-crystal former. And the another part is the neutral API molecule. So if you see the basic difference between the salt and the co-crystal is that salt is having the two parts, both are counter ions. Whereas in case of co-crystals, both are the neutral molecules. So this is a combination of two neutral substances just because of hydrogen bonding or physical interactions. Next slide please. जैसे मैंने बताया, every person is having a problem. सबको लगता है कि अपना प्रॉब्लम पड़ा है. जैसे आपने हर एक ह्यूमन बीइंग को भी प्रॉब्लम है. कोई ऐसा है जिसको प्रॉब्लम नहीं है यहाँ पे? Can anybody say कि मुझे प्रॉब्लम नहीं है? दुनिया में एक ही जगह है जिसके प्रॉब्लम नहीं है. कहाँ ऐसे लोग कहाँ मिलते हैं? कोई बता सकता है? ग्रेजुएट में. बाकी सब जगह प्रॉब्लम है. तो सभी API को प्रॉब्लम है. Which are the problems are there? Poor dissolution rate, solubility, moisture uptake, compressibility and chemical stability. So these are the issues are there which are giving the problem to formulation scientists. Because formulation scientists faces कई बार क्या लगता है कि drug discovery person को लगता है not comparing, but drug discovery person को लगता है कि this drug is developed, you prepare a tablet. But preparing a tablet is not an easy job. What is required? Good material properties they are required. That is required good flow properties, good compressibility, and the solubility is required. So these are the various approaches which are used traditionally to overcome this particular problem. Complexation, salt formation, solubility enhancement technique, and number of solubility enhancement techniques are there which are available in the literature. Change in storage condition, addition of certain excipients, stabilizers, you can change, you can stabilize that particular thing. And one is there, crystal engineering. सबने engineering पढ़ा है, pharma engineering? कोई बोलते सर बड़े मुश्किल से तो पास हुए, कोई ऐसे बोलते हैं because there is lots of equation, lots of graphs are there. So this is crystal engineering is one of the area where you can work with that includes co-crystallization and crystal habit modification. Next slide please. So what is the crystal engineering basically? You know that the formation of crystal that depends on what? Depends on the conditions you maintain during crystallization. एक सिंपल थिंग है, आपको यदि कोई नया प्रोजेक्ट करना है, एक कोई ड्रग को एपीआई मॉलिक्यूल को लो, उसको अलग अलग सॉल्वेंट में सोल्यूबल करो, सैचुरेटेड सॉल्यूशन बनाओ, एंड क्रिस्टलाइज आउट इन डिफरेंट कंडीशन. सडनली कूल करो, स्लोली कूल करो, डिफरेंट कंडीशंस में कूल करो, पॉलीमर्स ऐड करो, यू विल फाइंड यू आर गोइंग टू गेट क्रिस्टल्स विद द डिफरेंट फिजिकल प्रॉपर्टीज. स्टडी दैट फिजिकल प्रॉपर्टीज. इसके लिए कोई बहुत ज्यादा इंस्ट्रूमेंट लगते हैं? क्या लगता है? एक बीकर, एक ग्लास रॉड और डिफरेंट स्टोरेज कंडीशंस, डिफरेंट सॉल्वेंट्स. आई थिंक हर एक कॉलेज के पास ये है. एंड यू नो दैट मैक्सिमम थिंग्स व्हाट वी आर डूइंग फॉर इवैल्यूएशन पर्पस वी आर आउटसोर्सिंग. XRD है, DSC है, दैट इज ऑलरेडी अवेलेबल, यू कैन डू दैट आउटसोर्सिंग. सभी कॉलेजेस करते हैं आउटसोर्सिंग. तो आपका ये जो रीजन है सर काय कराओ आपके फैसिलिटीज नहीं, this is a reason where you can overcome this particular problem. So here crystal engineering is the very thing that is generally considering a design and growth of crystalline molecule solid with aim of changing the material properties. So you can change the material properties. You will find drastic difference. आप सिर्फ एक काम कीजिए, कोई particular saturated solution बनाइए and cool it suddenly, cool it slowly and thirdly कीजिए, directly pour that particular solution, saturated solution onto a cold surface. और आप तीनों को जो भी आपका प्रेसिपिटेट आएगा उसको आप एनालाइज करके देखिए, you will find there is vast difference in solubility. Doesn't it novel? Do you think? Are you finding out something new thing? What is research? Research is what? Not doing anything like Einstein. Einstein is different. What is research? Finding out any particular new idea, maybe a tiny, maybe a small thing, but a new thing. So what you can do, change the small things are there that maybe add novelty to your research work. Okay? So what you can do, changing this climate modification, changing solvent system. अलग-अलग solvent को use करके, अभी मेरे 2 students कर रहे हैं इसके ऊपर काम. And I am getting a very good result. बहुत simple है. अलग-अलग solvent लिए हैं, अलग-अलग proportions में लिए हैं, and then just what we are doing, crystallize out करो. And check the properties. And what we find, there is vast difference. Almost there is solubility 50 times more as compared to the parent API molecule. दोनों में crystalline है. We are not converting to amorphous form. What we are doing, we are doing just changing the conditions. So changing crystalline condition, temperature, rate of cooling, rate of heating, addition of seeding agents. सभी को मालूम है. You can add certain seeding agents, you can add certain polymers, so that you can get a different crystalline form. So this is one area where crystal engineering, you are changing the properties. You know the different size and shapes of crystals are there. You are changing the habits of that particular crystal so that you are going to get a crystal with the required qualities, required material properties. Next slide please. This is crystallization process. Everybody is aware. हमने कई बार पढ़ी है मायर्स थ्योरी ऑफ क्रिस्टलाइजेशन, पढ़ी है ना? कई लोगों ने तो फार्मा इंजीनियरिंग के 2-3 टॉपिक पे पास किया है, मैंने तो भी. क्रिस्टलाइजेशन, मिक्सिंग, ड्राइंग, ये 2-3 टॉपिक बहुत फ्रेंडली थे, बहुत अच्छे से पास कर देते थे हमारी क्रिस्टल इंजीनियरिंग को, है ना? कई बार हमने इसके ऊपर शॉर्ट नोट भी लिखी है, राइट अ शॉर्ट नोट ऑन मायर्स थ्योरी, बिकॉज़ द मोस्ट फेवरेबल क्वेश्चन फॉर स्टूडेंट इज द शॉर्ट नोट. है या नहीं है? Yes or no? B.Pharm student, है ना? So this is a crystallization process, Mayer state of crystallization, where there is a growth of crystals right from molecule up to crystal. It involves various steps. So development of crystal is not a spontaneous process. It starts from molecule and ends up to a crystal development. Next slide, please. Then comes to co-crystallization. So co-crystallization is what? Co-crystallization is defined as a complex of two or more neutral molecular constituents. Very important. Yeah, सबसे important क्या चीज है? Both are neutral. Like in salt, both are having certain charge. In hydrate, one is solvent in nature. But in case of co-crystallization, both are neutral constituents, and very important is that they are bound together through non-covalent interaction. सबसे important. When there is non-covalent interaction, means there is no chemical change. Only physical change are there. Only physical interactions are there, like hydrogen bonding, pi interactions, and other interactions are there, which are considered to be a physical interaction. There is no chemical bonding, so there is no complex formation. Actually, this is just a physical complex, we can say. Is that just a physical complex where these two entities, they are bind together by just the physical interaction, and maximum physical interactions are the hydrogen bondings. Okay? So here the formation of pharmaceutical co-crystals involves incorporation of API with another pharmaceutically acceptable molecule. Pharmaceutically acceptable molecule. API is pharmaceutically acceptable. तभी वो API हुआ है, approve हुआ है, API हुआ है, and another is co-former. So co-former is also pharmaceutically acceptable, means it is grass listed. What is grass? Anybody? Anybody grass? कोई? GRAS, generally regarded as safe. These are the lists which are published by USFDA and different FDA time to time. This is a list of various agents, various ingredients which are considered to be safe and pharmaceutically acceptable. So what is this co-crystals? Both API molecule as well as the co-former, both are having the pharmaceutically acceptable. And third important is maintains intrinsic activity. These two things are combined together. One is API, other is co-former. यदि दोनों combine हो गए, लेकिन pharmacological activity change हो गई, it's of no use. So what is important is that for co-crystals, because it is not a chemical interaction, it is just a physical interaction of the co-former and the API molecule. So that's why the intrinsic activity or the pharmacological activity of that particular drug is maintained. That is the beauty of this co-crystals. That is aim. If the intrinsic activity is changing, then it's of no use. And last and very important, and that's why the industry is attracted towards this co-crystal as one of the approach, that is opportunity for intellectual property for these co-crystals. So industries are attracted towards this because there is opportunity for these co-crystals. They are patentable. They are patentable. Yesterday we were discussing, sir, and that time the sir is also saying that there are certain co-crystals which are patented, IPR. So because industry want money, industry want profit, and from where the profit is coming? Profit is coming from the IPR. So they are very well patentable. Co-crystals are very well patentable because they are qualifying all the three criteria of patenting. That is novelty, non-obviousness, and industrial applicability or commercialization. So all these three qualities which are required for patenting any particular thing, they are very well qualified by the co-crystals, and that's why these co-crystals, they are very well patentable. Next slide please. थोड़ा थोड़ा समझ में आ रहा है सभी को? B.Pharm स्टूडेंट, यस और नो, हाथ ऊपर करो. B.Pharm स्टूडेंट पीछे वाले, मेरे पीछे के खास दोस्त, मेरे ज्यादा यंग फ्रेंड, ज्यादा खास दोस्त है मेरे पीछे वाले, है ना? सो मेकिंग सम सेंस. हो सकता है कि मैं B.Pharm में हूँ, मैं सुन के क्या करूँगा, मैं सुन के क्या करूँगी, ऐसा नहीं है. Because ultimately we know that after B.Pharmacy, 70 to 80% of students they are going for post graduation. So if there are certain ideas about this research, अभी आप सब deliberation सुनोगे, तो you will get certain gist of research कि क्या actually हो रहा है, what is the research is. These are the advantages of research. This focus already we discussed. major advantage what we discuss is no need of break of covalent bond. They are stable, they are patentable. Yield is very high. Yield of co-crystal is almost 100%. Whatever method you are using, the yield is very high. There is no byproduct formation, and very important, you can use certain green technologies. अभी पूरा जमाना ग्रीन का है, इको फ्रेंडली टेक्नोलॉजीज. ग्रीन जैसे आप ग्रीन बोलते हो, इको फ्रेंडली बोलते हो, what happen? The acceptance chances of your paper they are more. मैं ज़्यादा objective oriented है ना? As soon as the eco friendly method, novel method, the acceptance chances are. So you can use certain eco friendly methods like sonocrystallization. You can use ultrasonication, you can use microwaves, you can use other techniques are there where the you can attack these eco-friendly techniques to this co-crystallization, and grass crystal compounds are there, so that's why they are non-toxic in nature. Next slide please. So now we come to co-crystal. समझ में आ गया सबको? अभी हमने क्या करना है? पहले दो अलग-अलग थे. एक यहाँ रहता था पूना में, दूसरा रहता था औरंगाबाद में. दोनों अलग-अलग कैरेक्टरिस्टिक्स थे. या बोल सकता है एक इंडियन था, दूसरा कोई बाहर का था. दोनों का कॉम्बिनेशन कर रहे थे. हमने सोचा क्यों ना दोनों एक ही कैटेगरी को, एक ही बिरादरी के हो, एक ही रिलीजन के हो. तो हमने ये सोचा क्यों ना हम ड्रग और ड्रग को ही को-क्रिस्टल्स करते. बिकॉज इट सीज दैट आप कई बार ड्रग और ड्रग का ही कॉम्बिनेशन, दिस आल्सो कंसेप्ट व्हिच इज कमिंग. आई थिंक डॉक्टर आर.के. माहेश्वरी इज आल्सो वर्किंग ऑन दिस फ्रॉम इंदौर. ही इज वर्किंग ऑन व्हाट इज द इफेक्ट ऑफ सोल्युबिलिटी ऑफ वन ड्रग ऑन अनदर ड्रग. And he is working on enhancement of solubility of one drug in presence of another drug by hydrocarbons and other techniques. So this is an area where what we thought other co-former को दूसरा क्यों लेना, दूसरे बिरादरी का क्यों लेना, तो हमने ड्रग को ही एक co-former करके लिया. So we can get advantage of two things. जो co-former inactive था उसके बजाय हमने क्या किया, एक एक्टिव मोइटी को ले लिया साथ में, and we come to a conclusion and we come to a one new moiety that is drug co-crystals. So here both the components are API. दोनों भी component API ले लो. एक drug रहेगा API और दूसरा भी API रहेगा. Yeah, and in required proportion. Second, it will change PK and PD. Both will be changed. अभी तक हम PK के ऊपर concentrate कर रहे थे, only pharmacokinetic. But why when you take drug co-crystals, दोनों ड्रग है तो PD भी चेंज होगा. What is PD? That is pharmacodynamic. So dynamic is also changed because both are drug now. दोनों भी ड्रग है. Clear? Suppose two are the anti-TB drugs, or if you are taking two are the anti-hypertensive drugs, so automatically there are chances of getting synergistic or the additive effects. So here changing PK and PD, it will overcome the problems of fixed dose combination. अभी क्या किया है, FDA ने बहुत सारे FDCs बैन कर दिए, आपको भी मालूम है. 2-3 साल पहले बहुत सारे FDCs बैन कर दिए. So that problem you can overcome. You can claim it is not FDC, it is a co-crystal. Okay? So in that way, it can overcome the problem of FDC. It is delivery of dual drug therapy. Two drugs can be given simultaneously, but it should be complementary. नहीं तो आपने बनाया कैफीन और बारबिट्यूरेट का को-क्रिस्टल यूज होगा. एक तरफ तो नींद दे रही, दूसरा सुला रहा है. इट्स ऑफ नो यूज. They should be complementary with each other. So when selection of the co-former, they should be complementary with each other. So that's why dual drug therapy, जहाँ पे भी दो ड्रग की थेरेपी है, you can combine these two drugs in a required proportion, and there will be the formation of co-crystals. Then synergistic or additive effect. Life cycle management. अभी industries is working on life cycle management. You know that patent का कितना term है? Only 20 years. Only 20 years is the period. So to extend the life cycle of the patent, the industries is going for co-crystals. What industries they are doing, that is called as evergreening strategies. That is called as evergreening strategies. Company want to extend the life cycle of that particular patent. So what companies they are doing? अभी पेटेंट एक्सपायर होने वाला है क्या, उसका नया को-क्रिस्टल फॉर्म करो and again they are patenting. So life cycle management and improve the physicochemical properties. Next slide please. In designing a co-crystal, there are simple 3 steps are there. We will not go in very much detail. First thing is designing, second is screening, and third is selection. Designing means first इवेल्युएट द प्रॉपर्टीज ऑफ द फ्री ड्रग, जो भी आपका एपीआई मॉलिक्यूल है, जो भी आपको काम करना है, उसका पहले यू डू दी फिजिको केमिकल प्रॉपर्टीज इवैल्यूएशन ऑफ दैट एंड देन डिफाइन द स्कोप कि आपको करना क्या है, whether you want to increase compressibility, whether you want to increase solubility, what is the problem with that particular drug. कई बार क्या होता है, स्पेशली इन द एमफार्म स्टूडेंट्स, वी डोंट नो कि करना क्या है, सर ये ड्रग आ गया है एंड देन चलो इसकी solubility एनहांस कर देते हैं. Okay, so that's what is required. First study that particular API molecule and find out what is the problem that is lying with that API molecule. Many API molecules are there, they are suffering the problems of the compressibility. Metformin, आप metformin की compressibility problem solve करो, industry will give you much money. Metformin ऐसे drugs है किसी compressibility बहुत ज़्यादा problems है. So define the scope and screening and then select the co-crystal former. Proper co-crystal former is selected. Then screening, what you do, you use various methods. There are various methods are there. We'll see next slides. That development of co-crystal, it may be a traditional method and the advanced methods are there. And then characterizations are there. Many methods are there which are used for characterization of co-crystals. Next slide, please. सबसे crucial step है selection of co-former. भाई को कैसे ढूंढना? Compatible भाई. एक तो एपीआई, एक तो ढूंढ लिया, उसका कंपैटिबल भाई लगेगा आपको, तो इट विल बी अ वेरी कंपैटिबल. सो मोस्ट इंपॉर्टेंट इज दैट इट इज द मोस्ट क्रूशियल स्टेप इनटू द co-crystal formation because the co-former should be such that it should have the ability to form the hydrogen bonding. It should have the ability to form the physical interaction like pi interaction and the other interactions are there. So सबसे पहले आपको ये स्टडी करना है कि these two drugs are there. So whether there is possibility of formation of hydrogen bonding, and you will see various methods are there where you can find out very well that whether there is possibility of crystal formation, co-crystal formation or not. Okay? So find out that which functional groups are there, which are intermolecular interactions possible. They should be GRAS listed. You can use the chemistry structural database which is available. You can find out certain functional groups. Very well functional groups are there. सभी में जनरली रहता है कार्बोक्सिलिक ग्रुप, अमाइड ग्रुप, अल्कोहल ग्रुप्स आर देयर व्हिच आर हैविंग एबिलिटी ऑफ फॉर्मेशन ऑफ इलेक्ट्रोनेगेटिव एटम चाहिए हमको टू फॉर्म द हाइड्रोजन बॉन्डिंग. सो COH ग्रुप, अमाइड ग्रुप, अल्कोहल ग्रुप्स आर देयर. These are the groups which are very well for the co-crystal formation. Okay? And then also it is found that those compounds which are showing polymorphism, they are more suitable compounds. Hydrogen donors and hydrogen acceptor molecules which are present in that moiety that can be counted and having similar pharmacological action, that is API for drug co-crystals. Next slide please. Hydrogen bonding approach is there, जो सभी को मालूम है. You can use the Graf-set notation system to study the hydrogen bonding systems, and you can count the proton donors and acceptors for the hydrogen bonding. Next slide please. Another approach is there, a very simple approach, pKa method. Very simple. pKa सभी को मालूम है, ड्रग का pKa आपको मालूम है का स्टैंडर्ड वैल्यू, और को-फॉर्मर का pKa मालूम है. क्लियर? दोनों का डिफरेंस निकालो. If the difference between the pKa of drug and pKa of co-former is less than 3, दोनों का डिफरेंस यदि less than 3 है, the formation of co-crystal is very high. If the pKa difference is more than 3, the chances of co-crystallization is less. Very simple method. आपको कुछ करना नहीं है, उसका pKa निकालना है गूगल से. गूगल बाबा तो है हमारे पास. गूगल बाबा को कोई भी बोलो, गूगल बाबा बताएगा ये pKa है और ये pKa इसका है, right? But don't rely on Google. आप गूगल को हर एक बार अलग-अलग देंगे, हर एक बार अलग-अलग pKa देंगे. So go for the standard books. Okay? So just pKa of one API molecule, pKa of the co-former, just make a difference, and that difference is less than 3, it will form the co-former. Another approach which is systematic approach, that is called Hansen's solubility parameters. थोड़ा complicated approach है ये, will not go in much detail, but very simple. In that, it is the Federer group contribution method. Federer group contribution method is that you are calculating the solubility parameters depending on the various groups which are present into the moiety. The standard values books में present है. You calculate the solubility parameter of drug, solubility parameter of API molecule. These are the formulas which are given. These formulas they are available in or certain research papers. Yeah? And recently some research papers they have published that use of Hansen solubility parameters of the co-crystal prediction, and it is found that almost 80% of success rate is there by Hansen solubility parameter calculation. Yeah? So you can, now the software are also available for calculation of Hansen solubility parameters. You can calculate the Hansen solubility parameter of drug, Hansen solubility parameter of API molecule. Next slide please. And if the difference between these two solubility parameter is less than 7, then it is miscible, the formation of co-crystal is more, or chance of co-crystal formation is there. If the difference is more than 7, it is immiscible and they are not selected. तो आपको अभी तक आपने कोई भी फिगर को हाथ नहीं लगाया, कोई भी इंस्ट्रूमेंट को हाथ नहीं लगाया, आपने क्या किया है अभी तक एपीआई मॉलिक्यूल्स दिए हैं और कोफॉर्मर दिया है, और अभी तक पूरा पेपर पे चला है. Even if you publish up to this, it will publish to one of the good journal, not maybe a reputed journal, but you will find very few papers are there in this particular area. Another method is in silico method. In silico के boss मेरे सामने बैठे हैं, मैं तो क्या बोलूँ, all these are the which are using these softwares routinely. Both of you are using these softwares. So docking, molecular docking is there, and we use this molecular docking for prediction of co-crystals. Yeah? So molecular docking simulation between API and co-former by using the autodock, dock, dewdock, glide, even strategy we use for this. And these parameters we study the interaction studies, free energy binding, hydrogen bonds, one-to-one interaction, hydrophobic interaction, pi-cation interaction, bond distance, molecular conformation. All these are the data which is available. तो आप इन सिलिको स्टडीज भी कर सकते हैं. स्टिल अभी हमने कोई बीकर को किसी को हाथ नहीं लगाया. अभी भी हम कहाँ हैं? Just selection of the co-former, selection of co-crystal. So here you are selecting a co-former by, if you are selecting the co-former correctly, your 75% of work is done. So that's why these are the methods are there. You can use this in silico method. You can use molecular modeling software for proper selection of the co-former. Next slide please. Then another is saturation solubility studies are there. Very simple method, saturation solubility studies. What you are doing, saturation solubility studies of API is carried out. Co-former or API की saturation solubility study करो separately, and then API and co-former is mixed. Temperature is slowly increased, and if the saturation temperature is more than 10 degrees centigrade, then that is selected. Next slide please. These are the methods are there where you can form the co-crystals. इसके लिए ट्रेडिशनल मेथड के लिए तो आपको कोई बड़े इक्विपमेंट नहीं लगते. स्वालोन की ऑपरेशन टेक्निक सभी ने प्रैक्टिकल की स्वालोन की ऑपरेशन के ऊपर किया होगा कोर्स. So you can use स्वालोन की ऑपरेशन टेक्निक. You can use solid state grinding, just पेसल एंड मोटर. हमारा साथी जब तक फार्मेसी है तो पेसल मोटर तो चलता ही रहेगा, है ना. फर्स्ट ईयर से लेके तो हमेशा के लिए, शादी होने के बाद घर पे जेंट्स लोगों के लिए लगता ही है ना, सभी को लगता है कोई ना कोई फॉर्म में. So that is a solid state grinding, pestle and mortar you can use, or mechanical milling you can use in some solid. If you are not having the mechanical mills, even simple pestle and mortar will do. Solvent induced techniques are there. You can dry grinding and wet grinding methods are there. You can add small amount of solvent, different solvent you can add, and you can go for co-crystallization. Slurry technique. You can add the solvent, you can make the slurry continuously, and then it is evaporated. And solvent drop technology, slowly one drop solvent is added, and then you can form the co-crystals. More advanced techniques are there. ये तो conventional techniques है. Advanced techniques are there. Microwave assisted synthesis. I think microwave maximum colleges में PCI का requirement है. PCI का requirement है तो maximum जगह हाई है. किसी के लिए LG का लाके रख दिया है वो बात अलग है. लेकिन है microwave. Just I'm joking है. हो सकता है सभी के पास sophisticated हो. Just I'm joking because क्या होता है कि monotonous रहा तो मजा नहीं आएगा आपको भी लेक्चर, है ना. तो that's why here microwave assisted techniques are there. That's why it is available in maximum colleges. You can use microwave technique. You can apply here the various parameters of microwave. You can apply your DOE on this microwave here, and then you can come out with good results. So microwave techniques, solvent, supercritical fluid technology, बहुत कम जगह available है. Ultrasound बहुत जगह अवेलेबल है, अल्ट्रासोनिक इश्यूज, क्लियर? ये प्रोब सोनिकेटर बहुत जगह अवेलेबल है, यू कैन यूज दैट प्रोब सोनिकेटर एंड इवन इफ व्हाट हैपन द एक्सपोजर टाइम इज सो लेस, जैसे यहाँ आपके पास अवेलेबल नहीं है, मैं क्यों बोल रहा हूँ, बिकॉज सर यहाँ हमारे पास एक बड़ा मिथ है कि अब मैं कहाँ करूँगा, क्या जाऊँगा, मेरे पास एक फैसिलिटीज नहीं है, बट माइक्रोवेव अपने पास नहीं, दूसरे कॉलेज में है, इट रिक्वायर्स हार्डली 1.5 hour टू कंप्लीट ऑलमोस्ट 5 बैचेस, 2-3 मिनट की बैच आप पूरा लेके जाओ, और मुझे नहीं लगता कोई भी कॉलेज मना करेगा। आप लेटर लेके जाओ, मैथ के लिए लगता भी है, कोलैबोरेशंस दोनों का फायदा है, सभी के दृष्टि से आपको देखना है, दैट इज रिक्वायर्ड। सो इन अल्ट्रासोनिक असिस्टेड टेक्निक, स्प्रे ड्राइंग टेक्निक यू कैन यूज, वेयर इज हाई शेयर कन्वर्टर बहुत कम जगह अवेलेबल, फ्रीज ड्राइंग, लेजर रेडिएशन, then extruders, electrochemical induced and resonance acoustic techniques are there. That are the techniques where it can be used for the formation of co-crystals. Okay? But what I mean to say here, even if you are using this traditional technique or some of the microwave assisted technique or ultrasound technique, you can get a very good results with a good novelty of your research. Next slide please. Co-crystal characterization. अभी दूसरा क्वेश्चन दिमाग में होता है, सर को-क्रिस्टल्स तो बना लिया, हम करेंगे क्या? सबसे पहले क्या करना है हमको, व्हाट आर द प्रॉब्लम इज देयर, जो उस प्रॉब्लम के लिए सिलेक्ट किया है, उस प्रॉब्लम को सबसे अच्छी बैच कौन सी दे रही है वो सिलेक्ट करो। सपोज यू आर गोइंग फॉर solubility enhancement, n number of batches you prepare, the batch which is having the highest solubility that can be selected, or 1 or 2 batches can be selected, and if you are applying DOE, you are applying different design of experiment, you are applying different experimental design, the optimum batches are there, 2 or 3 batches are there, that can be sent to the different agencies, different institutions for the characterization. अभी ये होगा कि देखो फैसिलिटीज आपको ये कैरेक्टराइजेशन मैक्सिमम कॉलेजेस बाहर ही भेजते हैं, ऐसा बहुत कम कॉलेजेस है कि जहाँ ये सब फैसिलिटीज अवेलेबल होगी। So you can do stability studies, you can do melting point सब लोग कर सकते हैं, stability studies are that is very possible, solubility possible, ideal intrinsic dissolution rate ये बहुत कम जगह पॉसिबल है, बट मॉडिफाइड इंट्रिंसिक डिसोल्यूशन रेट दैट यू कैन डू। अभी कई बार होता है सर इंट्रिंसिक डिसोल्यूशन रेट कैसा करें, ये इंस्ट्रूमेंट हमारे पास नहीं है, ये हमारे पास भी नहीं है। तो हमने क्या मेथड यूज किया था कि एपीआई मॉलिक्यूलर को-क्रिस्टल्स, उसका हमने डिस्क बनाए वेरी हाई प्रेशर से, क्लियर, और मार्केट से वही साइज का एक टैबलेट लेके आए क्रिस्टल, उस टैबलेट को बाहर निकाला और इस टैबलेट को इसके अंदर फिक्स किया। हमारा इंट्रिंसिक डिसोल्यूशन का एम क्या है, सिर्फ एक सरफेस ओपन होना, बाकी सरफेस क्लोज होना, सील होना, यही हमारा एम है। बहुत सोफिस्टिकेटेड इंस्ट्रूमेंट नहीं चाहिए हमको। सो व्हाट यू हैव डन, वी, और उसको अप एंड डाउन मूवमेंट है तो उसको हमने स्टिक कर दिया डिसइंटीग्रेशन टेस्ट एपेरेटस को, डबल साइड पेपर से, क्लियर, और पूरा बाकी सील कर दिया, एंड वी कैरी आउट द डिसोल्यूशन रेट एंड द रिजल्ट्स आर सो अमेजिंग दैट इज एक्सेप्टेड। ये मॉडिफिकेशन प्रिंसिपल रिमेन सेम, कुछ भी नहीं लगा, डिसइंटीग्रेशन टेस्ट एपेरेटस ही था, उसको सिर्फ 2 साइड पेपर से लगा दिया एंड इंट्रिंसिक डिसोल्यूशन रेट इज कंप्लीटेड। सो इंट्रिंसिक डिसोल्यूशन रेट यू कैन डू एट योर ओन। मैं ये सजेस्ट नहीं करता हूं कि आपका शायद एपेरेटस इज वेरी गुड, बट नहीं है तो दिस टेक्निक्स आर देयर दैट कैन बी डन। सो XRDs you can send a single crystal XRD, it's a very good technique, but unfortunately थोड़ा कॉस्टली भी है और हमारे पास बहुत कम जगह फैसिलिटी अवेलेबल है, but that can be done। इंफ्रारेड IR सभी के पास है, रमन स्पेक्ट्रोस्कोपी, DSC and this, yes, NMR is required in the last because आपको मास निकालना है उसका, SEM, polarized light microscopy, hostage microscopy and TGA। So these are the techniques are there। इसमें से आपको 50% टेक्निक ऐसी है को आसपास मिल जाएगी, आपके कॉलेज में मिलेगी। If other techniques are not there, just for your information, अभी ये SAF चंडीगढ़ है, IIT का SAF है, that is sophisticated instrumentation section at Chandigarh and IIT at a very reasonable rate for the student, it is available। बोलता है एम्बेसडर नहीं होगा, ये तो बोलेंगे सर आप उसकी मार्केटिंग क्यों कर रहे हैं, क्लियर, जस्ट फॉर इन्फॉर्मेशन एंड वेरी सिंपल, आप एक फॉर्मेट भर के दो, within 15 days you will get a good results। ये हमने किया है चंडीगढ़ से भी और मुंबई से भी, रिजल्ट्स बहुत इकोनॉमिक रेट में आ चुके हैं। सो यू कैन डू दैट, these are the facilities you can outsource very well, which are available freely, which are available at a very economic rate, especially for the students, clear? So there are the various characterization methods are there. Next slide please. These are the examples examples of drug co-crystals which are available in the literature. If you find all are complementary, tramadol and celecoxib, but celecoxib is banned now. पूरे coxib बेचारे ban हो गए हैं. Only epicoxib is there into the market. All ropicoxib, celecoxib, all they are banned because of the sudden liver problem and the problems are there. So ashwagandha, paracetamol, naloxone, aspirin, these are the examples are there. If you see maximum work which is done into this particular area of drug co-crystal is in anti-TB. Anybody क्यों होगा? Anti-TB में क्यों है maximum work? Because if you know anti-TB में maximum combination therapy चलती है. Because single drug developer resistance. So this can be a miracle for the anti-TB where the combination therapy is always recommended. Okay? So you can couple two drugs simultaneously so that it can give a synergistic action, it can give a different action and it can reduce the resistance. So anti-TB are there which are maximally, they are the examples which are available in the literature. Next slide please. This is a commercially available drug co-crystal Entresto. It is a valsartan, sacubitril, which is for heart failure is required. Another is diphenhydramine, N-chlorothiazide for motion sickness. These are the officially commercially available drug co-crystals. What it means? It is accepted. Commercially, जब एक acceptable हो गया, दो acceptable हो गया, that means slowly the acceptance of drug co-crystal is increasing, and that's why मैंने जो टॉपिक का नाम किया था गेम चेंजिंग अप्रोच. इफ ये slowly increase हो गया, ये accept हो गया, that may be a change to an API industry. And you know that India is a big leader into the API. तो हो सकता है हमको उससे बहुत बड़ा boost मिल सकता है. But challenges are there. ये बहुत अच्छा दिख रहा है. But there are certain challenges. Main challenges are there. There is no guarantee that synthetic drug co-crystal is pharmaceutically acceptable. जैसे मैंने बताया, theophylline, phenobarbital. No practical rational. So सबसे पहले practical rational होना चाहिए आपको for that. Second is, another is that the co-crystal they are formed in a particular stoichiometric ratio. Okay? But the dose may be different. Aceclofenac का dose different है, paracetamol का dose different है. Okay? But for formation of drug co-crystal, what is required? You require a particular amount, a particular stoichiometric ratio of this drug and the co-former, and that may cause a clinical difficulties. So to correlate with this dose and actual requirement of co-crystal is maybe difficult for the correlation. There is selection of appropriate combination, and very important is regulatory ambiguities. अभी कोई FDA परमिट करता है, कोई FDA परमिट नहीं करता है. The definition of co-crystals varies from FDA to FDA. यूरोपियन FDA कुछ अलग बोलती है, US FDA कुछ अलग बोलता है co-crystals के लिए. कोई बोलता है कि ये पेटेंटेबल नहीं है, कोई बोलता है पेटेंटेबल है, कोई बोल रहा है कि these are the single moiety that are considered to be different moiety. You see next slide please. So IPR जैसे मैंने बताया, इधर all these three utility भी है, novelty तो है, दो नए ड्रग है, सबसे चीज लगती है novelty, non-obviousness and the industrial applicability. So novelty is definitely there because you are selecting a novel combination of two substances. Novelty, no doubt. Non-obviousness, you can prove because n number of methods are there, n number of co-formers are there. You can use all these methods to prove the non-obviousness of your work. And third is industrial applicability. You can prove that because of this co-crystallization, these properties are increased. Maybe solubility, maybe other properties are improved, and that's why the utility can also be proved. So that's why all commercial advantage भी है and therapeutic advantage भी है for this co-crystals, and that's why it is attracting the industries. Next slide please. मैंने बताया ना regulatory problems are there, regulatory ambiguities are there. US FDA says that these are the solids that crystalline material composed of two or more molecules same crystal lattice structure. What EMA says, they are single phase system. Homogeneous crystalline structure made up of two or more components. Means what? Another is that this US FDA says that they are DPI, they are that is drug product intermediate, they are not new compound. Whereas EMA says that they are new active compound. So these are the ambiguities are there into the regulatory bodies. ऐसा होता ही है। जब भी कोई नई चीज आती है तो एम्बिग्यूटीज होती है, सब अपना अपना कहती है, वो तो अच्छा बात अपने यहाँ नहीं आया था, वो तो अपने तो हर एक आदमी अलग बोलता है। मैं तो बोलता हूँ जब क्रिकेट मैच जब खत्म होती है ना, उसके बाद किसने कैसा खेलना चाहिए था, ये सब लोग अपना अपना बोलते हैं। क्यों कभी कभी खेलने वाला विराट कोहली कंफ्यूज हो जाएगा कि मैं बोल रहा हूँ यार ऐसा नहीं मारना चाहिए था, उसने ऐसा करना चाहिए था, उसने कार्ड ऐसा घुमाना चाहिए था, बिकॉज एवरीबडी इज फ्री, सो दैट्स व्हाई एवरी इज आल्सो फ्री, सो दे आर डेवलप्ड देयर वेरियस डेफिनेशंस आर देयर, सो दैट्स व्हाई देयर इज स्टिल ambiguities are there, but as time passes, as more and more examples will come, as more and more acceptability will be there, what will happen, this will be more and more clear as per the regulatory perspectives they are concerned. Next slide please. This is a case study what we have done, that is we prepare a drug co-crystal bidacurine with a natural co-former, and this is a patent application is just published, and this is also got a best thesis award at Pune, that is at D.Y. Patil College of Pharmacy. That is a P.D. Patil award, आपको सभी को मालूम होगा. So this is also got an award for this. We got here, next slide please. We also got the next slide please. Then UK patent also got for the patent. Next slide please. You can see these are the recent reviews are there. ये मैंने क्यों लिए? आप देखिए कोई भी टॉपिक जब नया होता है more acceptability there, reviews आना शुरू होते हैं. You will see drug crystal के जितने भी reviews है, they are in the late 20s. 1920 से आना शुरू हुए, maximum 21, 22 के. That means ये area भी coming up. Yeah? So this is we can say the review in the future journal, that is solubility enhancement of formiderol using drug co-crystallization with hydrochlorothiazide. This is recently into the 21 का review है, drug co-crystal opportunities and challenges. 21 में आया. Next slide please. This is a drug approach to overcoming pain management. You can see specifically in pain management they have done the review drug co-crystals. Then co-crystals for anti-cancer drugs. Yeah? So anti-cancer drugs are there. Two scientists of anti-cancer they are sitting here, so they can have this co-crystals into the anti-cancer therapy. You can see here all these are the reviews and the research are there, which is just recent after 20 or 21, 22. That means this is a very recent area and nascent area you can tap it. Okay, next slide please. सबसे अच्छी स्लाइड रहती है आगे वाला कंक्लूडिंग रिमार्क है ना. So concluding remark, co-crystals are the promising approach to improve the physical properties of the API molecule, and the DDC is totally a new concept that can change the API industry due to its low risk. Low risk इसलिए है कि already proven है. API is proven and another API is also proven. That's why it is a low cost, low risk, more advantages. However, today there is limited published work is available on drug co-crystals, and marketed drug crystals are very rare. Only two drug co-crystals are there which are marketed. So development of drug crystals have many challenges and already discussed here. There is need for pharmaceutical scientists to develop robust models for predicting drug co-crystal. So all pharmaceutical scientists, present and future scientists are there. So this is the opportunity for you. You can face up these challenges and you can come up with a newer and newer drug co-crystal. So patent has been the most important feature. And very important slide. Next slide. Thank you. कई बार तालियां दो जगह से बजती हैं. ये देखिए यूजी की तालियां कुछ अलग रीजन से बजी, पीजी की तालियां कुछ अलग रीजन से. आई नो यूजी वाले बोलते चलो एक बार खत्म हो गया, पीजी वाले बोलते अच्छा था. बट आई एम अ पॉजिटिव पर्सन. I always take that all they understand the things something. हो सकता है पूरे ये बहुत बड़ा टॉपिक है, is not possible to cover in 1 hour. It's a very big topic, but I try to cover this. At least you get what is the gist, what is co-crystal is, and how this drug co-crystal is more important. So that may be very useful. That creates a one in the language of crystallization. That creates a one nucleus in your mind. एक nucleus आपके दिमाग में create हो गया होगा. That molecule and nucleus is created. Definitely, that will precipitate. That will develop a big crystal in your mind as a form of drug co-crystals. So thank you very much. The management of Bhalchandra College of Pharmacy, Principal Dr. Shirsat, and all the management member, all the staff member for inviting me, and most important, my young friends and मेरे दोस्त, मेरे पहली बोला था, we are all thank you very much for your precious listening.
Thank you, sir. The session was really helpful for the upcoming researchers. Attention everyone, it is a time for lunch. Please proceed a delicious meal and enjoy your break. Thank you. There is an arrangement for the staff or guests at in front of stage and for student.